I helped with the American Heart Association to get new laws passed. One law required to put AEDs in every school. The other law required all schools to have a medical emergency response plan, because you'll never know when it's your time to save a life.
Without a dispatcher on the other end who knew CPR and knew what to do and knew how to communicate it to a parent in the worst moment of their life, I'm not sure where our son would be today.
I think if you asked us well before we got the AHA, the Voices for Healthy Kids funding, that we would have said, yes, it's really obviously important that the people that we serve are part of the decisions that we make. But we were doing that in the way that lots of folks do it. But now inside of our organizational structure, we have a group of people who we've invested in, who've invested in us.
Let's start in Mississippi, where the Department of Education realizes kids like me can get up to 50% of our daily calories at school. So they adopted Smart Snack Standards in 2016, giving the healthy food choices an easy A. And that's not all. School fundraisers selling junk food, like donuts, pizza, and candy, are totally off limits.
I will continue to fight to ask our federal government to get involved and please do something about this surprise billing. Some people will choose not to have medical treatment because they're afraid of the next medical bill.
Funding research gives all of us a better chance of living a healthier life. Without the research done, we could not have moved forward and have found cures or have even found medicine to help us, the survivor.
20 years ago, I suffered a massive stroke. If I would have had access to TPA through telemedicine, my life would be completely different. Congress, support the FAST Act so anyone who suffered a stroke can get the proper care they need.
Oregon is also determined to keep kids on the right track. The project, called For Every Kid Coalition, raised a record $3.5 million for safe routes to schools. That money will help ensure the safety of a lot of students.
Preemption leads to health disparity because it blocks lawmakers from being as innovative as they can in their approach to population health. Local governments are uniquely positioned to address the needs of their community, and often they are key to passing laws that deal with health, safety, and equity. In so many cases, local leads the way.
Fortunately, this time around, my search for individual coverage was very different. Thanks to the Affordable Care Act, I filled out the online application and chose a plan. I called and spoke to a representative. She double-checked and said the premium was correct. After a long pause, she realized I was crying. I explained to her that having affordable insurance meant I could hold out for the job I wanted and not the one I had to take. But by the end of our conversation, she was crying too.
We need to stop youth tobacco use to end the irreversible effects it causes to our generation and our environment. The Tobacco Endgame at American Heart Association and rehabilitation programs such as Students Working Against Nicotine all function to alleviate tobacco use in teenagers.
And you always come away feeling that you're not alone, and that all of a sudden you're part of something that you weren't before.
Because I want to save people's life like they saved mine.